What's up, everyone? It's Brian from the Exact IT Solutions YouTube channel. Welcome to another video where we talk about all things cybersecurity and help educate you about the things out there that you need to protect yourself from. Today, we're going to get into two cyber attacks on two very large healthcare entities. One of those is Tenet Healthcare. The other one's the American Dental Association. I'm going to let you know what happened on the other side, so let's get into it. All right, guys, so we have Tenet Healthcare, one of the largest healthcare providers in the United States, based out of Dallas, Texas. They released a press release stating that they are dealing with a cyber attack as of last week. We are starting to see a number of increases on top of increases around cyber attacks that happen to companies. And here we have a large company. There are hundreds of small companies under attack right now. Let's remember that. Before I get into it any further, remember to like and subscribe to our channel. And Tenet Healthcare, back to pen and paper, like all hospitals do, investigating a cyber attack. They shut down their systems as a precaution to try to remove or stop anybody from getting any further access to their systems. But here we have another healthcare entity that's dealing with a cyber attack. We don't have a lot of details on this, but we know that healthcare is a big target for cyber criminals. Large organizations like this that run multiple healthcare facilities are prime targets. They have a ton of endpoints, a number of computers that can be infected with something like ransomware, and can cause the hackers to demand a huge amount of money to get your files back, get them unlocked, get operational again. And you also have a treasure trove of data. What we're starting to see with groups like Lapsus and other groups, they care more about the data and what they can do with that after they get their hands on it, who they can sell it to, who they can extort with it, than they do about deploying ransomware. The cyber criminals have kind of figured out at this point that they don't need ransomware to get companies to pay them. If you steal data that's important enough, that data that should be protected, you're going to end up having to pay, or you're going to end up trying to have to make a decision around, is that the better option here than maybe option A, B, or C, just paying these guys off to get them to go away. I'm not recommending that in any sort of way, but as you see it boil down, as you see companies go through these ransomware events, and the numbers start to add up, what has to be done starts to add up. The number that the cyber criminals threw at you initially starts to make a little bit of sense, and it starts to say, well, 300,000, I'm not saying that's the number here with Tenet, but if you're a business owner and you do have access to $300,000 in cash, and options A, B, and C are going to cost you more than that, sometimes you need to consider these things even though you shouldn't, because that's what makes the most business sense to do. And unfortunately, you're dealing with smarter and smarter cyber criminals every day who get more experience with these types of attacks, know what they can and what they can't get away with, and they know what number to come in with initially to try to get their most bang for the buck, and they know where the floor is. They know, what they're absolutely going to take as a minimum payment, because they know your company and they know what you can afford. Couple that with maybe some ransomware insurance policies in place, and these cyber criminals come at you with a lot of leverage. So we have another hospital organization here that has fell victim to a cyber attack. We don't know if it's ransomware at this point. We can only suspect that it is, being in the manner that they shut things down. But they are working with their doctors, their hospital staff, on making sure patient care gets delivered, but it is on pen and paper, and it is in using backup methodologies, which nobody likes to do in any job when you're so reliant and dependent on technology. So we have, them being down. So we also have the American Dental Association. We also have American Dental Association reeling from a cyber attack as well. And their cyber attack, they revealed on Friday that they suffered a cyber attack, and they've been forced to take many of their systems offline. And the ADA, is coming out and saying that they are experiencing technical difficulties. Again, another healthcare organization that's having an issue that's involved in cybersecurity. And you can see above my head an ad for a HIPAA compliance checklist. A lot of these companies and a lot of these healthcare organizations, and if you're involved in healthcare, you're not afraid of HIPAA. And unfortunately, it takes events like this for HIPAA to get involved. And HIPAA is very busy investigating breaches like ransomware attacks across thousands of organizations involved in healthcare. It's very hard for them to keep up. But these things rear their ugly head after the event, what we call right of boom. And this is why companies need to start paying attention to this stuff today. You need to, step number one is have somebody come in and assess your environment. Tell you where you stand today, where you can be cyber attacked, and start to prioritize those things from top to bottom. Get the most important things out of the way first. A lot of companies don't do a good job with things like network segregation, two-factor authentication, password hygiene or password managers, security and awareness training. These are things that, should be at the top of the list, should be things that you put in place fairly easily, fairly simply, and they do a lot for cybersecurity and preventing things like this from happening. So, the healthcare industry has been on alert for a long time for these things, and there's no end in sight, and it's not going to end anytime soon. And if you think, by some magical way, somebody's going to come along and stop this stuff, I'm here to tell you that's not going to happen. So make sure you have the right team in place. Make sure you have enough resources in place for your size organization. These organizations are very large organizations, probably, have to deal with HIPAA in some way, shape, or form. And they need to do a better job of securing their networks. These are the things that are going to happen. Large, small, medium, it doesn't matter. These cyber criminals want your data. They want to extort you for having it in their possession. And that's the name of the game today. Ransomware is almost dead, although it's a very effective tool. It's no longer needed by criminals to extort you for money, to cause a breach, to cause you to break violations, to break compliance regulations, and potentially break laws because you weren't doing enough to secure the data that you're entrusted to secure by your customers, by your patients. So that's it for me. Tenet Healthcare, American Dental Association, cyber attack. See you in the next video.